Hi, my name is Yasu, and in my video, I talk about a lot of different things that mainly what has happened to me and how I have been dealing with one of the topic the one of the topics that I mainly talk or discuss is mental health, how to overcome depression, how to proceed depression uh, treatment, because um, I suffered from depression, insomnia, and other kind of medical conditions in the last 3 years. After 2 years and 10 months, officially, uh, I completed I completed my depression treatment and my insomnia treatment as well. I was taking Effexor for my depression, and I was taking many different kind of sleeping pills like nitrazepam, halcyon, Lunesta, Dayvigo for my insomnia. But I put everything behind, and it's been 2 months since I officially ended everything with my doctor. Like my doctor officially um, gave me that I successfully beat everything. So I don't see my uh, psychiatrist anymore. And in terms of Effexor, I don't take that anymore, and I don't take it for 1 year and 3 months already. So really successfully, I completed my depression treatment and so on. So today, based on my personal experience of beating depression, I want to talk about what is the most important things when you proceed your depression treatment. There are a lot of different kind of factors, and I will talk about it. But as a starter, I want to really clarify what is the most important thing based on my experience. And it can it can vary based on what kind of medical help you have access to, because different country offers different medical procedures, medical supports, and so on. So my experience is really based on what I could get in Japan, because I live in Japan. So the most important things to cope with, deal with, proceed depression treatment is to establish trusting relationship with your psychiatrist and understand the limit, how much your psychiatrist can really help you, and understand in the depression treatment session what's the role for me and for my psychiatrist. And it's really based on how much I can trust my psychiatrist, and vice versa as well, because psychiatrist is the one who's going to assess my condition and then guide me through that. Is it better for me to take more medications or stop taking it, and so on? So it's not one way, it's a two-way street. I need to trust my psychiatrist, and the psychiatrist needs to trust me, because otherwise my psychiatrist wouldn't know what kind of conditions I'm really in and how to carry on the treatment, and then how to precisely, accurately guide me through to um, how do I say? Start reducing my medications, stop taking the medications. If I suffer from withdrawal symptoms, how to encounter, how to deal with, to make sure that I'm not going to relapse, and so on. To make sure that I'm not going to suffer from unexpected or anything else when I'm treating my depression. And it's really, really hard, because when I was suffering, the first time ever that I was really suffering from depression, at first I felt down. I couldn't really feel, I couldn't really have much energy in me, and also like slowly I can feel that I am deteriorating back then. I didn't know what's going on. I never thought that I was really started to suffering from my depression. But something was clearly wrong with me. And looking back, everything that I suffered from back then, it was really the early signs of me getting into depression. But I was not informed, or I was not educated about these kind of early signs that I might possibly starting suffering from depression. So I really couldn't catch everything on time. And then when I couldn't take it anymore, of course I went to see a psychiatrist seeking help. And in Japan, that first session with a psychiatrist, doctors could accommodate like 30-minute session or longer than 30-minute session. But it's not long enough for someone who is already suffering from depressions, being panicked, feeling down, in a completely dark 30 minutes or more than 30 minutes time to explaining what's going on. It's not possible. And but at least letting as much out, having someone professional like a psychiatrist to listen to me helped. But it doesn't cure anything. And although I could understand that my psychiatrist is deep professional, but for him to suggesting that I should consider to start taking antidepressant, specifically Effexor, on the first day of seeing him. It was really scary, especially like I really didn't educate myself enough that what could be the pro and what could be the cons of taking antidepressant. I never heard of Effexor before, and there was a part of me that I'm not that kind of person who suffered from depressions. I should be okay. I just need a little bit more time to get some rest, and then I'm here just to get like second opinion just in case, because I don't know what's going on with me, but I'm sure I'm gonna be okay. I'm not that kind of person who suffers from depressions. I have this mentality, but I was really suffering anyway. And even though there was a part of me saying that don't take medications, don't listen to the doctor, I was desperate. And also, the logical side of me was telling me back then that I'm not a doctor, but I can really feel that something is clearly wrong with me. Like something is really breaking in me, that I really need the professional help. And I am not the person who should make any decisions. Just simply listen to the professional, which is the psychiatrist. So, the logical part of me won. So on the day, without thinking much, I agreed with my doctor. And on the day, for the first time in my life, I took antidepressant. And then I felt sicker. Because the side effect of Effexor is very uncomfortable. He warned that this could happen to me. It's just a part of the process that I need to go through, like my brain and my body to go through. A week, a couple weeks, but afterwards it's gonna get better. He warned. So of course I was informed. But it's just, I was already suffering from so much pain from depressions, and then now on top of that, suffering from the side effects and everything. It was the most difficult time in my entire life. And then I was looking for the info about Effexor, and then looked into the side effect. Basically the same thing as what my doctor said. So I just powered through everything. Did I not doubt my doctor? I did doubt everything because it just made me feel sicker. But at the same time, I understood that there were no other options because I'm just so deteriorated. I'm so damaged, and I just don't know what's going on. But as time went by, as side effect went away. My mood swing got really stabilized, even with lowest dose of Effexor. So Effexor was actually very suitable for my situations and for me. And I think this is a good experience, like successful case for me to actually rely on, to trust my doctor. So in that setting, I think I was lucky because the first shot with my first antidepressant, and then side effect sucked, but it went away, and then I could feel its effectiveness. So I kept increasing the doses, and then when I hit the highest dose, I was able to regain my energy level back, which was actually amazing. But in contrary, my insomnia got worse. It's really, really killing me. So in terms of dealing with my depressions, the Effexor was really effective. So it was basically increasing the doses, watching out how my body reacted, reporting back to my doctor, and confirming that everything just worked fine. At least like moving towards better outcomes. But when it comes to insomnia, I was really suffering. My doctor was suggesting many kind of different kind of sleeping pill, increasing the doses, but it just didn't work until I found the right combination of different sleeping pills. But it took months, like I think 6 months. It was just, it's a hell. Yet, I didn't stop trusting my doctor because of Effexor. Effexor was very the success case model that I could really trust my doctor. And that was the first experience with my psychiatrist. And because of that, I could keep believing and trusting him. And of course, when I was suffering from insomnia, by changing medications, nothing really worked in the first couple months. I suffered a lot, but at the same time, I understood that one medication couldn't fix everything altogether. There's always side effect, which is causing insomnia a lot harder to deal with, but something that I need to sacrifice, but hopefully have it under control by finding different medications, which is sleeping pills. So I was willing to go through the hell, which I'm super traumatized. That is why I'm so focusing on my quality, the quality of sleep. But this is the experience that I developed with my doctor, that I could trust him. And I guess I'm more logical person to set what my role is as a patient and what the role is for my doctor, because he's the one who could subscribe me medications based on my situations, and the situation needs to be provided by me. So I was keep measuring my sleep. I keep writing little journal with what I felt, what happened to me, how my body react to it. And then once a month, I came back to him, and my role is, on average, how much I was able to sleep. What could be the major physical symptoms that I suffered? Are there any positive outcomes that I could feel, or any kind of negative, anything neutral? What my thoughts are, anything that I feel uncomfortable with. And then based on that, my doctor's role is to prescribe me medications and then decide whether increase, keep it, decrease, and then finally stop taking. And it worked well. It helped me to do expectation management from my side towards him. It really sets the clear lines that how much I can depend on my doctor, as well as how much I need to work or figure out on my own to find a way to get out of the mess, which is very painful. But there was that unfortunately that's the only way, especially in Japan, because once we finish the first session, from the second session with my psychiatrist, it could only last, each session could last only 5 minutes, or it needs to be less than 10 minutes because of the because it's a insurance covered, and it must be kept within, it can go a little bit more than 5 minutes, but it needs to be less than 10 minutes session with per person. And it's not something the doctors can change if it is covered by the insurance, national insurance. So many people in Japan really misunderstand that doctors don't want to spend time on them. They want to just deal with patients like just restaurant customers, just deal with as many as possible to make as much money as possible. That's not what doctors' intentions. Their hands are tied. They can really see each person a little bit more than 5 minutes, but certainly less than 10 minutes because of the national insurance system. If patients want something more, it needs to be something that's not covered by insurance, and it costs a lot of money. Luckily, I learned that at the early stage of my depression treatment. So I was able to adjust my expectations, how to interact with my doctor. But knowing that it doesn't help. Trust must come in and play a big role, which luckily I was able to establish because of Effexor. And as time went by, I could really feel that my doctor really trusted my monthly report about me reacting to medications, how I assessed my condition. Because because he made a decisions to increase the medications, change the medications, keep the medications for months, started to tapering off, stop taking, and adding extra medications for my sleep when I was suffering from withdrawal symptoms. He was very cooperative. It seems like he was it seems like I was making progress as I reported to him. And I guess he was right. And also I was right. That's why I really overcame my depressions and everything, successfully finishing everything. So trust comes two-way streets. I trust my doctor, so I do what he tells me to do. But at the same time, he needs to make diagnosis and then come up with a treatment plan, adjusting my meds based on what I tell him. And he needs to really, really trust what I tell him. Yeah. So yeah, the most important things to overcome depression, finish depression treatment successfully is to trust, establish trusting relationship between you and your psychiatrist. That's the foundation of everything. Yeah, that's the foundation of everything. And it's not easy things to do because I don't think I would be able to trust my psychiatrist if Effexor didn't really work on me. So that I would have to change my antidepressant and just going through a lot of side effects and then doubts and everything. Then of course I don't think I could trust him. So I guess I was lucky too. In that sense, I was lucky because Effexor really worked well on me. Even though I compromised sleep so much, which only later on I realized that my insomnia got worse potentially because of Effexor. Back then I was not really realizing that because I was being panicked and then rushed and then went to see my psychiatrist for professional help is because for the first time in my entire life, I couldn't sleep. So I was really suffering from many things. But the biggest part is I couldn't sleep. And it was just so unusual because until then, up to then, I never ever had insomnia, never had a sleep issues in my entire life. That's why when I started having insomnia, couldn't sleep, didn't know what's going on with me, went to see my doctor. I couldn't really notice back then that one of the reasons, or probably the major reasons why it took so long for me to figure out what can have my sleep under control is because of effects causing or making my insomnia more severe than what it was before I was taking Effexor. But there's always something to compromise. No medication can cure everything. So for me to deal with my mood swings, super low energy level, I chose to, not chose. I ended up compromising sleep without realizing. Yeah, if I realized that that could be really major cause why I was really suffering from insomnia, then I may have stopped taking Effexor, or maybe I'm not sure, because it was really effective on my mood swing, feeling down, and then energy level. So maybe even I was suffering from my sleep issues, insomnia. I might be okay with it, I'm not sure. Anyway, yeah, so it's not easy when you're suffering from depressions. Everything is just so dark and painful, and you keep seeing your doctor, nothing seems to be working out. Feels like he's not really or she's not really listening to you. In that kind of situations, it's really hard for you to trust your doctor. But if you can find something that works on you because of your doctor, by focusing on that, you might be able to trust your doctor in a fair way to establish more open communications with your doctors for better treatment. That might be possible. Yeah, it's really hard. But this is based on my experience. The most important things when you deal with your depression, establish trusting relationship with the doctor. So thank you for watching my video. It's a long video. If you find it a little bit useful, please like it, and then if if you feel like it, please subscribe. Please take care. For now, John. Bye bye.